The most common chronic diseases are heart disease, chronic obstructive pulmonary disease, type 2 diabetes, depression. To these pathologies, the challenge of multimorbidity can be added. Over 80% of healthcare regions have successfully implemented care pathways to respond practically to the most common chronic diseases. The health plan represents a turning point in care for chronic diseases and in improving healthcare results. In recent months, potentially avoidable hospitalizations have declined by 11.4%. As for specific hospitalization rates for each disease, the percentage has reduced. 18.4% for chronic obstructive pulmonary disease, 6.7% for chronic heart disease, which represents a change in the trend since the health plan was implemented, 50.8% reduction in hospitalization for diabetes, which means Catalonia has a lower level of hospitalizations for diabetes-derived complications than any country in the world. Therefore, the challenge posed by chronic diseases requires the system to focus on the public. On the basis of the public's risk attributes, the health plan has stratified the entire population into several clinical risk groups. Here are some data that feature in shared clinical history, which has already been rolled out at the majority of levels of care. This information is included in this ICT tool, which is very useful for the various suppliers that share the same clinical information. As part of this new care model, electronic prescriptions are another tool for offering the public better care. These new resources make the system more effective, as well as increasing general practitioners' ability to resolve common and low-complexity diseases. Access to and the effectiveness of specialized care are improved with the incorporation of new care models in priority areas of diseases relating to the musculoskeletal system, mental health, ophthalmology, and dermatology. However, in Catalonia, 3 to 5% of the population are in complicated situation and have a high level of dependence, also requiring care from social services. As such, patients in very complicated situations require personalized management. One of the health plan's goals is to identify complex chronic patients, CCPs, and advanced chronic patients, ACPs. The first time such an initiative has been attempted anywhere in the world. The goal for 2015 was to identify 25,000 patients with these characteristics, but thanks to the efforts of all the professionals, 53,200 complex chronic patients and 10,200 advanced chronic diseases have been successfully identified. Their labeling in the shared clinical history and incorporation into a shared individual action plan improved the process of caring for chronic patients. All healthcare systems have access to the same information with view to 24/7 access to help with sound decision-making. Furthermore, in relation to community pharmacies, work is underway on the therapeutic drug monitoring program in order to personalize their doses. Moreover, in November this year, a document was published setting out the ethical guarantees as regards caring for patients with ACDs, along with identification in the shared clinical history. This consolidates the personalized care model. The Expert Patient Program, from which over 3,000 people have benefited, is following the same positive trend. If the growth continues at the current rate, in 2015 this project will achieve the goal of involving 5,000 people with chronic diseases in knowing about their pathology, taking responsibility, and self-healing. Thanks to the Expert Patient Program, people with chronic diseases know on average 13% more about their pathology and are therefore improving their habits, quality of life, and lifestyle, as well as their level of self-healing. It has also demonstrated effectiveness as regards average number of visits and hospitalizations per patient. In just 1 year, appointments have decreased considerably. In general, the following have been reduced: visits to general practice doctors and nurses, visits to the emergency department, hospitalizations. They have all declined considerably since the first year the Expert Patient Program started. In conclusion, with this initiative and others, the health plan is pursuing improvements in resolutions and in the accessibility of the healthcare system within the framework of a care model that is integrated so as to make the public the focus of the system.